but they don't have the strength to work right. Think of holding a rubber band stretched tight for 24 hours a day. It's tight, but it's lost its snap. This constant tension is squeezing the major blood vessels and nerves that run through the pelvic area. It's literally cutting off the supply line just when the signal arrives. This is a source of constant discomfort and tension. It makes it harder for your body to relax, which is necessary for sexual arousal. You can't be stressed, clenched, and erect at the same time. Third, the nerve problem: faulty wiring and compression. Let me explain biologically. It's a garbled signal. The pudendal nerve is the superhighway for feeling and the go signal for the erectile tissues. This nerve starts in the lower spine and runs right through the muscles of the pelvic floor. When those muscles are tight, they often pinch, squeeze, or irritate this important nerve. Think of a compressed nerve as faulty wiring. The signal gets messed up, slow, or weak. The result is less feeling and a delayed or incomplete response. Losing sensitivity is often the first sign of problems, but it's devastating to your confidence. You feel disconnected from your own body, making it harder to feel the signals and harder to fully enjoy intimate moments. The bottom line is, your vitality isn't gone. It's trapped behind this combination of stiff arteries, tight muscles, and compressed nerves. The spot we're about to target is the release valve for all three of these things at the same time. That's how powerful this 1-minute massage is. Before we get to how to do it, let me introduce myself and tell you about my approach. My name is Dr. Narita, and for the last 12 years, my work in urology hasn't just been about surgery and prescriptions. It's been about finding real, lasting ways for men to stay healthy in every way, physically, sexually, and emotionally. I've had so many men sit in front of me, feeling frustrated and alone, telling me, "Doctor, I don't feel like myself anymore." They're tired of quick fixes that don't really solve the problem. They're tired of feeling like they're just a bunch of broken parts. My philosophy is this: you're not a broken machine. You're an amazing system that needs the right kind of care. The problems you're dealing with aren't a mystery. It's a body issue that needs a body solution. My work has led me to study Eastern medicine and physical therapy because they understand something that Western medicine often forgets. The body works as one connected unit. The tightness in your hip flexors affects your lower back, and the tension in your lower back directly affects your pelvic floor, and yes, your potency. This massage isn't something I came up with. It's ancient knowledge that's now being proven by science. I recommend it to my patients not as something that replaces regular medical care, but as a key part of taking care of yourself every day. It's about giving you the power to be in charge of your own health. We're moving away from just waiting for something to go wrong and then taking a pill to fix it, to being proactive and using simple daily actions to prevent problems in the first place. It's about spending 1 minute a day to make sure you're comfortable and confident for years to come. So, let's find this important command center and learn how to use it. We've talked about why it's important: the circulation, tension, and nerve compression. Now, let's talk about how to do it. But before I show you the exact spot and how to do the technique, we need to talk about the 5 biggest mistakes men make when they try things like this. Avoiding these mistakes is what makes the difference between quitting after a few days and seeing real changes after a few weeks. Mistake number 1: being too aggressive. Too much, too hard, too soon. The mistake is treating this sensitive area like you're giving a deep tissue massage to a hamstring. Men are used to thinking that more pressure equals better results. Biologically, the area down there is full of delicate nerves and blood vessels. Applying too much pressure doesn't release tension. It can cause inflammation, irritate the nerve even more, and create tiny injuries in the tissue. This actually makes the blood flow problem worse. Practically speaking, if you're sore the next day, if you feel bruised, or if you feel a radiating unpleasant sensation, you're pressing too hard. The right pressure is like checking a ripe tomato, firm enough to make a slight dent in the tissue, but gentle enough that it feels good and slightly tender, never painful. Emotionally, pain makes you want to avoid it. If it's uncomfortable, you'll start thinking of it as a chore or a punishment, and you'll quit. We want it to feel like relaxed self-care, not a medical procedure you're forcing yourself to do. Ease up. Doing it consistently with gentle pressure is better than doing it hard every once in a while. Mistake number 2: the dry rub. Not using oil. The mistake is trying to do the massage without any oil or using the wrong stuff, like petroleum-based products or sticky lotions. Biologically, the oil isn't just there to make things slippery. It's an active ingredient. Dry massage creates too much friction on the skin, which can lead to irritation and tiny tears. More importantly, it doesn't let you get deep enough to address the blood vessel problems. The right oils, like castor oil, carry anti-inflammatory stuff deep beneath the surface, turning the massage into a chemical treatment. Practically speaking, you want to glide, not rub. Dry skin keeps you from applying the deep, steady pressure you need. Using the wrong products, like heavy mineral oils, can clog pores and counteract the hormone-supporting benefits of natural oils. The oil is half the solution. Emotionally, a warm, therapeutic oil makes it feel like a ritual rather than a necessary inconvenience. It engages your sense of touch in a comforting way, which is important for reducing stress hormones that interfere with function. Mistake number 3. The weekend warrior mentality. Being inconsistent. The mistake is trying the massage for 3 or 4 days, seeing only small changes, and quitting because you didn't get a miracle result. Biologically, we're trying to retrain years of tension and tight muscles. You don't get in shape after one workout, and you don't clear a traffic jam with one cup. The body responds to doing things consistently. It takes time for the artery walls to get stretchy again, for the waist to be flushed out, and for the nervous system to feel safe enough to really relax the pelvic floor muscles. Practically speaking, expect to feel some improvements in sensitivity and relaxation within 7 to 10 days. Expect to see real, measurable changes in firmness after 4 to 6 weeks. If you miss a day, don't try to make up for it by doing 10 minutes the next day. Just get back on track with your 1 minute. Emotionally, this mistake comes from wanting results right away. This takes patience and believing in yourself. When you stick with it, the reward isn't just better function. It's the feeling of knowing your body is responding to your care. You're proving to yourself that your system can still be fixed. Mistake number 4. Poor positioning and strain. The awkward angle. The mistake is trying to do the massage while standing in a weird way or sitting in a position that makes your hand or wrist cramp. Biologically, if your core muscles are tense or you're straining to reach the area, the very muscles you're trying to relax, your hip flexors and pelvic floor, will be tensing up, working against the massage. You can't relax a system that's being strained. Practically speaking, you need a comfortable, stable position that lets you apply pressure at the right angle without effort. I recommend 2 main positions: lying on your back with your knees bent and your feet flat on the floor. This completely relaxes your hips and pelvic floor, letting you reach the area easily. Or sitting on the edge of a sturdy chair with your feet flat and your knees wide. This opens the area a little and gives you good leverage. Emotionally, awkwardness makes you want to avoid it. If it's hard to reach, the 1 minute will feel like 5, and you'll eventually give up. Make it easy. Make it comfortable. Make it something you can repeat. Mistake number 5. Focusing only on the event, creating performance anxiety. The mistake is only doing the massage right before you're planning to be intimate or thinking of it as just something you need to do beforehand. Biologically and emotionally, when you only connect the massage to performance, you instantly add pressure, stress, and expectation. This spike in anxiety triggers your body's fight or flight system, which releases cortisol and adrenaline into your system. These hormones tighten blood vessels. They literally shut down blood flow to the non-essential systems, like the erectile tissue. You end up fighting your own body. The solution is to think of this as daily care for your overall pelvic health, like brushing your teeth. Do it at a neutral time, like after your shower or before bed. The goal is to build a healthy system so that the response is natural and effortless when the time comes, not forced and stressful. Now that we've talked about the mistakes to avoid, let's get specific. Here's the complete plan for turning 60 seconds of focused touch into deep health. First, finding the command center, the perineum. The spot is called the perineum, or in traditional Asian medicine, the Huin point. It's a place where the main energy channels of the body come together. Anatomically, this area is the diamond-shaped region exactly halfway between the base of your scrotum and the tip of your tailbone. You want the soft tissue right in the middle of that front half. The clue is that it's tender. Gently feel the area. You'll find a spot that feels a little different, maybe a soft indent. When you press on it moderately, it will be noticeably more tender than the surrounding tissue. This tenderness means you've found an area of tension and stagnation. This is your target. This spot is important because it sits right above the muscles that are essential for erections and ejaculation. It's also where the main artery dives into the deepest part of the pelvis to supply blood to the penis. Second, the technique. Refine your 60-second plan. Once you're in a comfortable, relaxed position, lying down with your knees bent is often best, and you've warmed your oil, follow this 1-minute plan. Step 1. Application, 5 seconds. Use enough warm oil, about a teaspoon, to cover the whole area. Let the warmth relax the skin. Step 2. The pressure check, 5 seconds. Place your index and middle fingers, or just your middle finger, whatever is most comfortable, on the spot and apply that ripe tomato pressure, firm but comfortable. Take a deep breath. Step 3. The circular pump, 30 seconds. Using that pressure, begin small, slow circles. Do it clockwise for 15 seconds. Imagine the movement encouraging stagnant blood to flush out and fresh blood to flow in. Do it counterclockwise for 15 seconds. This makes sure you're reaching all the surrounding muscle fibers and nerve endings. Step 4. The press and hold decompression, 20 seconds. Switch to a press and release pattern. Apply firm pressure, holding for a slow count of 5, and then fully release for a slow count of 5. Repeat 2 to 3 times. This sustained pressure is great for releasing the nerve, helping to decompress the trapped nerve branches. It also helps release specific trigger points that have built up in the deep pelvic floor muscles. Step 5. The deep breath finish, 5 seconds. Remove your fingers and take one final deep breath, inhaling into your belly and exhaling completely. This reinforces the relaxed state. Third, the oil. More than just lube. The oil is your therapeutic tool. I recommend starting with one of these 3 options to get the most benefits. Option A. Castor oil, the deep tissue penetrator. It works biologically because it contains over 80% renoleic acid, a powerful anti-inflammatory fatty acid that can penetrate deep layers of tissue. It has been shown to improve blood flow and reduce inflammation that causes tissue stiffness and constriction. The practical advantage is that it gives you a depth that lighter oils can't match. Use high-quality, cold-pressed organic castor oil. Option B. Black seed oil, the hormone and circulation booster. It works biologically because it's full of compounds that improve blood flow, reduce inflammation, and even support natural testosterone production. It's been used in Middle Eastern medicine for thousands of years, specifically for male vitality. The practical advantage is that many men report feeling warmer and more rejuvenated. Option C. The enhanced carrier blend, the custom mix. Mix equal parts castor oil and coconut oil for scent and antimicrobial properties. Then add 3 to 4 drops of high-quality rosemary or peppermint essential oil per ounce of carrier oil. Rosemary is a powerful circulatory stimulant, and peppermint creates a cooling, invigorating sensation that signals blood flow increase. Caution: essential oils are highly potent and must be diluted properly. Never use essential oils directly on this sensitive area without a carrier oil. Fourth, the boosters, the force multipliers. To make sure the massage is working its best, add these simple habits to your daily life. Hydration. Flushing the pipes. The increased circulation from the massage releases waste and toxins from the tissue. If you aren't hydrated, this waste sits and stagnates. Aim for half your body weight in ounces of water daily. Good hydration equals better blood flow and waste removal. Hip flexor stretching. Releasing the pull. The hip flexors and inner thighs are connected to the front of your pelvic floor. When they're tight from sitting, they pull on the entire structure, causing the tension you're trying to release. Simple stretches like the butterfly stretch or pigeon pose for 60 seconds after your massage can improve your results. Visualization. The mind-body connection. During the 60 seconds, don't just rub. Visualize the area. Imagine the muscles softening, the tight knots dissolving, and a stream of warm, fresh blood rushing into the area, carrying healing oxygen and nutrients. This mental focus amplifies the relaxation response. Gentlemen, I want you to think of this not just as a performance tool, but as an act of self-respect. The emotional impact of physical decline is huge. It's the fear of embarrassment, the avoidance of intimacy, the loss of that feeling that you're still vital. When you commit to this 1-minute practice, you're committing to your overall dignity. And the great thing is that when you fix that central traffic jam in your pelvis, the benefits spread to every part of your life, often in surprising ways. First, reclaiming bladder control. The practical relief is that many patients report a big improvement in urinary function. That annoying dribbling that requires you to shake and wait often disappears. Also, many men report fewer nighttime trips to the bathroom. The emotional impact is the freedom from worrying about leaks or interrupted sleep. You sleep better, you're less irritable, and you feel more in control of your bodily functions. Second, freedom from pain. The practical relief is that your pelvic floor is the core of your body. When it's tight, it pulls on your lower spine and hip joint. I've had patients come in for potency issues only to call me later saying their lower back pain is gone. The emotional impact is the return of physical freedom. Imagine being able to stand, sit, walk, and exercise without that nagging stiffness in your hips or back. This improves your mood, encourages more activity, and further boosts blood flow and health. It allows you to fully engage with life, your hobbies, and your family. Third, enhanced core power and stability. The practical relief is that when the pelvic floor is relaxed but functional, your entire core works better. For men who golf, cycle, run, or lift weights, a healthy pelvic floor provides a stable foundation. You'll experience better stability, less fatigue, and improved recovery. The emotional impact is confidence in motion. It's the feeling that you can still perform, maintain your strength, and keep up with the demands of an active life. The 1 minute of massage is just the start. The big change is the comfort, the freedom, and the restored dignity you feel when your body starts working for you again, not against you. Gentlemen, you're at a decision point. You can accept the idea that getting older means things will decline, that discomfort is just part of it, and that pills are your only option. This is the path of giving up. Or you can choose the path of taking charge. You can invest 1 minute a day on a simple technique that improves. Here's the translated and rewritten text. It improves how your blood flows, eases deep-seated stress, takes the pressure off important nerves, and helps your body work the way it's supposed to from the inside. We keep our fancy cars in good shape. We get our appliances checked regularly. We wouldn't let a traffic jam block the most important intersection in town. So, why wouldn't we give the same care and attention to our bodies, which are the most amazing, complex, and important systems we have? It's our own body after all. The investment is really small. Just a minute of your time, a few bucks for some good oil, and a willingness to try something new. The payoff is huge. You get your body working better, feel more comfortable, have less anxiety, and that quiet, lasting confidence that comes from knowing you're doing something real and important to take charge of your health. So, here's my last challenge for you. Try this for a month. Stick to that 1 minute routine, morning or night, using the right oil. Don't decide if it's working after just 3 days. Give it the full 30 days before you judge. Notice the small changes, the better sleep, the sharper feelings, the less tightness in your hips, and the quiet return of your self-assurance. I'm telling you, your best days don't have to be over. With the right information and simple, consistent habits, you can keep up and even improve your energy, your health, and your ability to take control, even as you get older. If this made sense to you and gave you some hope, go ahead and click the like button now to show you're committed to this path. Subscribe to the Dr. Narrative channel. I'm here every week, giving you practical, science-based solutions that go beyond the same old advice you always hear. And most importantly, leave a comment below. Tell me, what's the one change you've already seen since you started taking better care of your health? Your story will not only encourage me, but it will also give hope to another guy who's still struggling in silence. Take control, guys. You deserve the comfort, the freedom, and the confidence that comes with a body that's working its best. I'll see you in the next one. All right, let's talk, fellas. I want to be upfront about something that hits every man over 50. It's that thing we all know is there, but nobody wants to bring up.
We all think about it, though.
I'm talking about your mojo, your staying power, and that feeling of confidence that comes from knowing your body is going to work when you need it to. You might have noticed things are a little slower now. Maybe things aren't as firm as they used to be. You might be having some unexpected pee problems, or that lower back pain that's been bugging you might be getting worse. Like most guys, you probably just figured this is what happens when you get older. But what if the changes you're seeing aren't just something you have to live with because you're getting older? What if the real problem isn't your age, but a simple little block in your body that you haven't even realized is there for years? I'm talking about a specific spot on your body, a powerful pressure point. When you work on this spot for just a minute a day, it can clear that block and reset your whole system. What if there was a simple, private way to take care of yourself that could seriously boost blood flow to your whole pelvic area, making sure that the spongy stuff that needs blood to get firm gets all it needs? What if you could ease the pressure on those important nerves that control feeling and response, bringing back that youthful sensitivity you've been missing? What if you could release that deep tension in your core muscles, easing stiffness not just in the bedroom, but also in your lower back and hips? I know it might sound too good to be true. You might be thinking this is just another weird health fad. But hear me out. This specific spot, which we're going to find together, has been considered super important in traditional medicine for thousands of years. It's seen as the meeting point of vital energy, the center of male vitality. And now, modern neurology and physical therapy are finally showing us why this technique is so effective. I'm going to walk you through the whole process, step by step. I'll show you exactly where this spot is, sometimes called the $1,000,000 point. I'll teach you the precise 60-second massage technique that gets you the most blood flow and nerve benefit. I'll even tell you about the best natural oils that can turn this simple massage into a deep treatment for inflammation and blood vessel health. This isn't about popping a pill. It's about taking control of your own body and your own health. It doesn't require any expensive equipment, no awkward doctor visits, and just 1 minute of your time. This simple thing could be what you're missing to get back your comfort, your freedom, and your confidence. So, before we get into the nitty-gritty of the anatomy, I've got a quick request. If you're serious about finding natural ways to be healthier, hit that like button right now. It helps this important stuff get past all the junk out there and reach more guys who need it. And drop a comment below. Tell me, what's the biggest thing people get wrong about getting older as a man that you want to change? Let's get the conversation going and build a community. Let's be real about the conversations men have, or more accurately, don't have, about performance after 50. The way society talks about it is pretty negative and discouraging. Things slow down, things get weaker, and eventually you just have to deal with it. Maybe you start taking a prescription to fix things quickly when you really need it. But just accepting that's how it is the biggest mistake we can make. Giving up is what kills your confidence way before your body does. I'm here to tell you that things almost never just suddenly go bad when you turn 50. It's a slow process, a tightening and squeezing that builds up over years of living in the modern world. The problem isn't that you're suddenly failing. It's that there's a traffic jam at a really important intersection in your body. When a guy starts having problems with erections, not as good, not as consistent, or not as much feeling, the main reason is 3 things all happening at once, and they all have to do with that spot we're about to massage. Knowing these 3 things is key to believing in how powerful this 1-minute fix can be. First, the blood vessel problem. Stiff arteries and not enough blood flow. Let me explain it biologically. Think of it like rusty pipes. An erection is mostly about blood flow, about 90%. The tissue in your penis is like a sponge that needs to fill up with blood quickly, and that blood comes from the internal pudendal arteries. These arteries go right through your pelvis. Years of eating bad food, inflammation, being stressed, and most importantly, sitting for long periods of time cause the lining of these vessels to get stiff. They don't stretch as well and don't respond as well to the signals that tell them to open up. Basically, when you're sitting all the time, gravity and pressure are squeezing these vessels. This slows down the flow, leading to blood that's not moving. Blood that doesn't have enough oxygen and has too much waste. It's like having rusty pipes. The water pressure is low, and the water quality is bad. This makes you less spontaneous. It takes longer for things to get going, because the flow isn't instant. This delay makes you anxious, which tightens your blood vessels even more, creating a bad cycle of worrying about performance. Second, the muscle problem, a tight pelvic floor. Let me explain biologically. It's a chronic tension thing. The pelvic floor muscles, PFMs, are like a diamond-shaped sling of muscles that control everything down there, your bladder, bowels, and sexual function. The thing about modern men is that their PFMs are often tight and weak at the same time. They're always tense because of stress, posture, and clenching.